If you're over 60 and you've been feeling tired, foggy, or just not yourself lately, this might be more than just aging. Maybe you've been blaming your sluggish mornings, forgetfulness, or unusual digestion on getting older. But what if the real problem is something far more serious and silent? Here's the uncomfortable truth. Your liver could be quietly failing, and your doctor might never mention it until the damage is already done. According to the American Liver Foundation, more than 100 million Americans, many of them seniors, have some form of liver disease, and up to 70% show no obvious symptoms. In older adults, the warning signs are often so subtle they're dismissed as just part of getting older. But the liver isn't just a digestive organ. It regulates hormones, processes medications, stores nutrients, filters toxins, and supports your immune system. When it stops working properly, every other system in your body suffers. That's why in today's video, we're exposing the 13 silent but medically recognized signs that your liver might be under stress. These symptoms are easy to overlook, especially in seniors, but spotting them early could help you reverse damage before it becomes permanent. We'll also share simple, evidence-backed strategies to strengthen your liver naturally without extreme diets or expensive supplements. Before we dive in, take a moment to comment below. What's one strange or persistent health symptom you've experienced recently that doctors haven't explained? Whether it's fatigue, skin changes, or digestive discomfort, we want to hear your story. And if you value clear, trustworthy health info designed specifically for seniors, be sure to like this video and subscribe to the Wellness Vault. It tells YouTube this content matters and helps us reach more people who need it. Number 1 is persistent fatigue and low energy. Feeling tired occasionally is part of life. But if you're consistently exhausted, struggling to stay awake after lunch, dozing off during conversations, or waking up tired despite 8 hours of sleep, it's not just aging. It could be a hidden sign your liver isn't converting food into usable energy effectively. The liver is responsible for producing glucose and regulating blood sugar, essential components of sustained energy. When it's inflamed or infiltrated with fat, its ability to fuel your body and brain declines. In seniors, this often results in vague, chronic fatigue that's easy to misattribute to age, medications, or poor sleep. But it could be a warning from your liver. And here's something most people miss. If you feel your energy drop significantly after eating heavy meals, especially fatty foods, it might be a sign your liver is struggling to keep up. Even more telling, many seniors report needing multiple naps throughout the day or feeling like they hit a wall in the early afternoon. If this feels familiar and isn't explained by medication or sleep apnea, it's worth having your liver enzymes checked. Number 2 is loss of appetite or nausea. Have you recently lost interest in food, skipped meals without meaning to, or felt uncomfortably full after just a few bites? These subtle changes can indicate that your liver isn't producing enough bile. Bile is critical for breaking down dietary fats. When bile flow slows or becomes blocked, common in liver dysfunction, you may experience bloating, indigestion, early satiety, and nausea. Seniors often brush off these symptoms, thinking it's just eating less with age. But a noticeable shift in appetite, especially if paired with mild queasiness or discomfort after eating fatty or rich foods, could be your liver signaling distress. Some seniors even report a metallic or bitter taste in their mouth after eating, combined with unexplained weight loss. These are signs worth discussing with your healthcare provider. This issue can snowball quickly. Poor appetite leads to malnutrition, which in turn weakens the liver further. If you're eating less, losing weight unintentionally, or simply feel off during meals, it's time for a deeper conversation with your doctor. Number 3 is brain fog and memory issues. The liver filters toxins like ammonia from the blood. If it can't do that efficiently, those toxins reach the brain. This results in confusion, forgetfulness, and what's commonly called brain fog. For seniors, this can mimic early dementia, but in some cases, it's reversible liver-related encephalopathy. Many older adults start noticing that they can't follow conversations as easily, or they forget names, appointments, or medications more frequently. If this mental fog comes and goes or worsens with fatigue, it may be due to toxin buildup rather than cognitive decline. A liver struggling to detoxify can profoundly affect mental clarity, mood, and focus. Some seniors describe this as a cloudy head feeling, like they're not fully present, even during everyday conversations. This can feel frustrating and isolating, especially if friends or family don't understand the connection between liver health and mental function. If you've been experiencing these cognitive changes, ask your healthcare provider about ammonia levels and a liver function test. Addressing liver-related causes early could help restore clarity and prevent misdiagnosis. Number 4 is dry, itchy skin and rashes. If your skin feels constantly dry or itchy without a clear reason, your liver may be the missing link. When bile builds up in the bloodstream due to reduced liver function, it can settle in the skin, causing irritation. Seniors should pay close attention to new skin issues, especially if moisturizers and ointments don't help. This kind of itchiness often worsens at night and isn't always associated with visible rashes. It's especially common on the arms, legs, and back. If scratching doesn't relieve the sensation and your skin appears normal otherwise, it's worth exploring liver-related causes with a healthcare professional. Another clue is the appearance of spider veins, dark patches, or thinning skin, which may also be linked to compromised liver function. These skin signs can look like cosmetic changes, but may reflect deeper imbalances. If you've seen a dermatologist and found no clear answers, bring up liver health with your primary care doctor. A simple blood test could uncover the real cause and get you back on track to feeling more comfortable in your skin. Number 5 is unusual changes in urine or stool color. Dark amber urine or clay-colored stool is a classic liver warning. These changes indicate that bile isn't being properly excreted. Even if you're hydrated, dark urine could mean bilirubin, a liver byproduct, is building up. Pale stool points to poor fat digestion, another sign your liver isn't working efficiently. These changes may appear gradually and are often mistaken for effects of medications or dietary shifts. Seniors especially may assume these changes are normal, but they are not. Keeping a simple record of changes in urine and stool color can help identify patterns. If discoloration persists, consult your doctor. These visual clues are your liver's early cry for help. In some cases, these color changes may be accompanied by a stronger or unusual odor, especially in urine. If these symptoms coincide with other digestive discomforts or fatigue, a comprehensive liver panel should be considered. Number 6 is easy bruising or bleeding. Your liver makes clotting proteins. If it's not functioning properly, you may bruise more easily or take longer to stop bleeding from small cuts. This isn't just cosmetic. Easy bruising could mean your liver's protein production is impaired. If you notice purple marks after light contact, bring it up with your doctor. In seniors, these bruises might show up on the forearms or legs even without any direct trauma. The combination of thinner skin and impaired clotting compounds the problem. Talk to your healthcare provider about running liver function and clotting factor tests. Early detection of coagulation issues can prevent more serious internal bleeding down the line. You might also observe tiny red spots on the skin known as petechiae, which can indicate minor capillary bleeding, another signal that clotting function may be compromised. Number 7 is swelling in the legs or abdomen. Known as peripheral edema and ascites, swelling in the lower body or belly is a warning sign of advanced liver dysfunction. As the liver loses its ability to regulate proteins and fluid balance, water leaks into surrounding tissues. Watch for socks leaving deep marks or sudden abdominal bloating. Swelling may worsen throughout the day, especially if you're on your feet for extended periods. Seniors may also notice discomfort while walking or bending over. If the swelling doesn't improve with rest or elevation, it's time to have your liver, and not just your heart or kidneys, checked by a medical professional. Don't overlook tight-fitting shoes or rings becoming harder to remove, which can be subtle indicators of fluid retention. Monitoring your weight daily can also help detect rapid changes linked to fluid buildup. Number 8 is yellowing of eyes or skin, jaundice. Jaundice is caused by excess bilirubin, a yellow compound that builds up when the liver can't process red blood cell waste efficiently. In seniors, jaundice may appear subtly at first, often in the whites of the eyes or under the tongue. It's commonly mistaken for dietary discoloration or dental issues, especially if it develops gradually. Yellowing of the skin may also be accompanied by general fatigue, dark urine, and pale stools, all signs that the liver's detox process is compromised. It's a signal that should never be ignored. Some people notice yellowing only under bright, natural light, making it harder to detect indoors. That's why regular checkups and routine lab work are vital for seniors at higher risk. If you notice even slight yellowing, especially if combined with other symptoms on this list, speak with your doctor. Early intervention can prevent progression to more serious liver damage. Number 9 is mood swings, depression, or anxiety. The liver plays a major role in hormone regulation and toxin clearance. When it's compromised, it can trigger emotional shifts that are often misdiagnosed as age-related mood disorders. Seniors with liver issues may find themselves more irritable, anxious, or feeling low, even if nothing has changed in their life circumstances. This emotional imbalance can sometimes be traced back to the liver's inability to process hormones and waste efficiently. Ammonia buildup in the bloodstream due to poor liver detoxification can also affect the brain and mood regulation. This condition, called hepatic encephalopathy, may be reversible if caught early. Loved ones may notice a shift in personality or emotional reactivity. Seniors may describe feeling off, overly emotional, or overwhelmed by everyday stressors. If you've experienced recent changes in mood without a clear cause, especially alongside digestive or fatigue issues, consider requesting liver function tests. It's not all in your head, it could be in your liver. Number 10 is unpleasant breath or metallic taste. Known as fetor hepaticus, a musty or sweet odor on the breath is a lesser-known but distinctive sign of liver issues. This happens when the liver fails to filter certain compounds that then make their way to the lungs. Similarly, a persistent metallic, bitter, or sour taste in the mouth, especially when not linked to dental issues or medications, can indicate a buildup of toxins normally cleared by the liver. These symptoms often fly under the radar, especially in seniors with reduced sense of taste or smell. Family members might notice the breath issue before the affected person does. If you notice persistent, unpleasant breath that doesn't improve with brushing, or a strange taste that lingers no matter what you eat, it's worth mentioning to your healthcare provider. A liver function panel and further evaluation could reveal a deeper cause. Breath and taste aren't just digestive. When it comes to liver health, they can be powerful indicators. Number 11 is weight gain without dietary changes. Fatty liver disease, particularly non-alcoholic fatty liver disease, NAFLD, is becoming increasingly common in seniors and often presents as unexpected weight gain, especially around the abdomen. If you're gaining weight despite eating the same or even less than before, your liver might not be processing fats and sugars correctly. Impaired insulin sensitivity due to liver dysfunction can make your body store fat more readily. Seniors often attribute weight gain to slowing metabolism or reduced activity, which are factors, but unexplained or rapid gain, especially with fatigue or bloating, may point to liver stress. Check how your clothes fit. Tightening waistlines and swollen midsections are often silent signals that something deeper is happening. These changes are not just cosmetic, they can reflect internal inflammation and fat accumulation around the liver. If diet and exercise aren't moving the scale, ask your doctor about a liver ultrasound or blood panel to assess for fat accumulation and insulin resistance. Number 12 is red palms or spider veins on the face or chest. Spider angiomas and red palms, palmar erythema, may look like harmless skin changes, but they are often signs of altered hormone levels caused by chronic liver disease. The liver helps metabolize estrogen and other hormones. When it's compromised, estrogen can build up in the body, leading to these vascular skin changes. They're often seen in liver disease long before other symptoms appear. Seniors may dismiss these signs as aging or sun exposure, but they are medically documented indicators of liver dysfunction and should not be ignored. These spider veins typically show up on the face, neck, upper chest, and hands. The redness in the palms may feel warm, but usually isn't itchy or painful. If you notice these vascular patterns, especially along with other signs on this list, bring it up during your next checkup and request liver-specific testing. Number 13 is sleep disturbances and night sweats. The liver performs many of its critical detoxification tasks at night. When it's inflamed or overburdened, this process can disrupt your sleep-wake cycle. Many seniors with liver issues report difficulty falling asleep, frequent nighttime waking, or waking drenched in sweat, even in cool rooms. These symptoms are often brushed off as hormonal or age-related, but can have a deeper metabolic root. Liver-related sleep disruption may also be tied to blood sugar swings or toxin buildup, both of which interfere with restful sleep. If you're waking up between 1 and 3 a.m. regularly, traditional Chinese medicine identifies this as the liver's peak activity time. You may also feel unrested despite sleeping through the night, another sign that detoxification is impaired. Add to that emotional irritability, and the sleep-liver connection becomes even clearer. Tracking your sleep quality alongside diet and energy changes can help your doctor identify liver patterns. If you're struggling with consistent sleep disruptions, it's time to dig deeper than just taking melatonin. Let's quickly recap what we covered today. We explored 13 silent yet significant signs that your liver could be struggling, signs that are especially easy to overlook in seniors, from persistent fatigue, brain fog, and nausea, to red palms, belly weight gain, skin changes, and sleep disturbances. Each symptom gives us important clues about liver function. We also explained why these signs often get dismissed or misdiagnosed, and how your liver plays a vital role in everything from energy, production, and hormone balance to mental clarity and toxin removal. Most importantly, we highlighted how early detection, simple dietary shifts, and conversations with your doctor can make all the difference. So now it's your turn. If you recognized even one of these signs in yourself or a loved one, please don't ignore it. Ask your doctor about a liver panel. Start tracking your symptoms and take small but steady steps to support your liver health. Early action is always more powerful than late reaction. We want to hear from you. Have you experienced any of these liver warning signs? Which ones caught you by surprise? Or maybe you've been dealing with something mysterious your doctor can't quite explain. Drop a comment below. We read everyone and love hearing your stories, tips, and questions. Your comment could help someone else in our community feel seen, supported, and better informed. And if this video helped you in any way, please give it a thumbs up. That small gesture tells YouTube this is content worth sharing, and it helps the Wellness Vault reach more seniors who might be facing these health challenges in silence. Also, make sure to subscribe to the Wellness Vault and turn on notifications. We publish weekly videos that break down complex health topics with science-backed advice made simple and actionable. Whether it's liver health, pain relief, longevity, or natural remedies, our mission is to help you live a longer, stronger, and more independent life. If you know someone who's been feeling off lately, send them this video. It might just be the piece of the puzzle they've been missing. Thank you so much for spending time with us today. We're honored to be part of your wellness journey. Remember, your liver might not complain out loud, but it leaves clues. Pay attention to the signs, trust your instincts, and stay curious about your health. This is the Wellness Vault, where wisdom meets wellness. Until next time, stay safe, stay well, and keep thriving.